you see here is us traveling through the countryside of Thailand. The ride to the hospital was an hour and a half northeast of Bangkok. I was amazed by the impoverished conditions these people lived in as we drove by. I didn't know what to expect as we arrived at the hospital. We were greeted by the military who helped transport the medical supplies from Bangkok. We traveled with a team of 56 to the Princess Sirindon Medical Center, including plastic surgeons, anesthesiologists, pediatricians, and nurses. We were greeted by the medical team at the hospital and the chief surgeon who thanked us for coming. And then we went to the wards, where we screened the first 50 children on whom we would perform surgery this week. Facial deformities included cleft lips, palates, and burns. This particular child had a cleft palate deformity, as you can see. This child had a condition called microtia, where he was born without an ear.
Have any other babies?
This 4-week-old baby had a complete unilateral cleft lip and palate.
Do any of the other children have only one child that had this?
I enjoyed the opportunity to hold this baby.
What was that?
You know, it's a red court in Bangkok.
A different hospital?
Sent him, yeah.
Why? Because they turned him down.
I'm glad that I was able to give these children a gift after a difficult day for them. So, how old are your children?
อายุเท่าไหร่
8 เดือนกว่า7 เดือนกว่า7 เดือน
7 เดือนครึ่ง2 อาทิตย์หรือ
ค่ะ
7 months and 2 weeks
Why are you guys here today?
มาทำไมที่
ก็มารักษาเด็ก
for like a repair for surgery okay
Are you happy about this opportunity?
ดีใจไหมหรือมีความสุขไหม
ดีใจ
You have good thing yes it's a pleasure to have you guys here okay what else
Is there anything you'd like to tell us?
อยากที่จะบอกอะไรไหมว่าที่หมอเข้ามาทำอะไรที่นี่บอกความในใจว่าดีใจเป็นยังไงมายังไง
ก็เราไม่มีตังค์แค่มาช่วยกันเราก็ดีใจนะ
They say they have no money and you come to help them. They're so happy, you know, to have you guys here. Okay.
เราไม่มีเงินก็เลยช่วยกันเลยดีใจ
Look at this. Look at this.
And I just wanted to thank you for allowing me to participate in the care of your children.
เขาก็ขออนุญาตว่าที่ให้เขาอนุญาตให้เขาทำผ่าตัดหรืออะไรเนี่ยเขาก็แฮปปี้ที่หมอมีความสุขว่าเราที่เราช่วยกัน cooperative very cooperative right yeah okay anything else oh okay
เมื่อไหร่
when they have surgery
Yeah.
พรุ่งนี้Hi yeah see happy
How you doing? All right, hello, Andrew's classmates.
Hi guys.
How's it going? So, we just did the cleft lips this morning, and you have a before shot here, and I'm sure you'll see the after in a couple of hours. They're not happy campers now, but once we take care of them, they're in great shape.
So how is anesthesia in a cleft lip case different from other pediatric anesthesias?
One major way that it's different is that a lot of these kids can have other issues just besides the cleft lip. So you have to look for mid-facial deformities and see if they have some syndrome associated with it, which also carries along the risk of like congenital heart defects, which is also a major concern. So that's probably the main thing that comes to mind. The other thing is probably the way that you mask the patient, because sometimes the deformity kind of goes up a little far, and so you kind of have to be aware of getting a good seal to be able to get them to sleep quickly. And the other thing is that they could also have deformities farther back in their oropharynx that make it difficult to intubate them.
So for this part, we're going to go break to the surgery, and there's going to be some elements of this that may be concerning to some people. So if you're one of those people who doesn't want to see surgery or doesn't like to see blood, this would be a time for you to step away during this part of the presentation.
So we're going to start with the incision. This is in order to repair the cleft lip. And at the same time as we do the cleft lip repair, we're going to also be doing some surgery on the nose.
He's doing pretty well out there. I don't know how much plastics he's doing.
I really always like that guy a lot.
He's a very nice guy.
You have to be very delicate because it's just a little baby. And this releases the nose. So this gives us the ability to move the nostril over to make the nose, the nostril symmetric. That's good. Okay. Cool. So this stitch is in order to narrow the tip of the nose. Hold this. So this stitch narrows the tip of the nose.
So yeah, it brings it up.
I'll let you take the patient. Beautiful.
So what are the issues surrounding recovering cleft surgery?
Well, recovering from cleft surgery is interesting because, as opposed to so many of the other kids where we're operating on their arm, their leg, or whatever else, these kids operating inside of their mouth and actually having them come out with a smaller airway than they went in with makes it difficult for the recovery, especially when we're doing the lips, where the children, before they went into the operating room, were breathing through a snorkel this big, and then we close it up and they're breathing through two little tiny nostrils. When you do it with the youngest babies, babies only breathe through their nose. They don't breathe through their mouth unless they're closed, unless they're crying, and these babies have never had a nose before. And so now what happens is you create two small swollen bloody nostrils and a baby who never had to breathe through that before. And the big issue is that their lip obstructs their airway, and so it's actually kind of difficult with the smallest babies, especially when we do the lips. But the palate's similar to that in that the back of their airway was wide open before they went in, and now we've closed that up their tongue flaps up against it. And again, a kid who was used to breathing through a much larger airway is breathing through a smaller one. So there's quite a bit of issue with recovering these kids.
I just wanted to thank everybody for coming out tonight and sharing this wonderful experience with me.